to First Friday, they can listen to the audio recording. If anybody objects to that, please know in advance I'm doing it and get off. But you can keep your microphones muted anyway, and your cameras as well. We do First Friday usually in a beautiful room. Web conference room is what I built and created, and we were able to have it live with a real audience, and at the same time we were able to record it and do it synchronously with people who could dial in. So now we're all dialed in and with cameras and with audio when all of that works and when the tech works. And this is our first virtual Zoom First Friday. And I was fortunate that my guest speaker, Dr. Diane Mangino, said yes, she would take this risk in this first time and be my guest speaker with me from the Center for Nursing Research and Evaluation on the studies we've been doing for the last 10 years, I think. And so that's kind of the way we've set this up. And Diane, I will give us some context to the background about how this was done with NSNA, and then I will bring you our latest data on student loan debt and program choice and how finance and loan debt influences our graduates to continue with their education, our baccalaureate graduates and nationally associate degree graduates, all of the graduates in nursing programs nationally. We have data that has been used for some of the policy circles on trying to make a case for financing nursing education. So I think one of the things I had added to this when we were planning this, and Diane will back me up and fill in even more, is somewhere around March or April, Diane decided and was asked what's going on in nursing schools with the COVID crisis. And so she launched what she does often in the organization, what she called a 2-minute survey. So we have pre-graduation data on schools. I'll share a little bit of that with you, and then we'll talk a little bit more about what we found with last year's graduates, knowing that this year's graduates are going to be really different. And finally, as part of this program, what I'd like to do is leave enough time, because we're about to send out the fall survey, and we'd love your ideas of what sorts of questions we ought to capture now, because you will see how well we are able to do this. It's been pretty awesome of the kind of responses we get, the kind of data. We've been used by the National Council of State Boards. I sent it to the Future of Nursing Report 2020. So they would be using our data because it is across the country and in other places where students are members of NSNA. So I will introduce my guest speaker, Dr. Diane Mangino. How are you doing with your setup?
Can you see me?
I can't, but yeah, well, I think we can, because I have, and we hear you. Can you see the screen?
I can see the screen.
You're awesome, Diane. Do you want me to click through the slides and you can just speak to them?
Sure.
All right, that'll make that part easy instead of transferring. But one of the things that we wanted to plan to do for all of you before we start, this is a very solemn day. And I don't know about you, but the TV has been broadcasting some very solemn moments. And what I'd like to do is start our talk off with a minute of silence in honor of the anniversary of September 11th, 2001. So I'll watch the clock. If everyone will mute your microphone for 1 minute. Thank you. So I'll introduce Diane first and give you a little bit of kind of insight into what this next maybe hour, probably less. We titled this, How Does Program Choice and Finance Options Influence Nursing Student Loan Debt and Progression or Continuation in Advanced Nursing Education? And this is pre-COVID. This is the graduates of 2019. I want to give a shout out to my research assistants, Dr. Renee Bonagora, who's on the call, Sharon Brown, who's on the call, and other Center for Nursing Research and Evaluation research assistants over the past years. We may be joined by our new interns, Ciara and Sabrina, and I welcome you all. This has been a project that we have done in association with NSNA. And Dr. Diane Mancino and I go back a long, long time. I won't tell how long. Diane has her EDD from Teachers College, a string of credentials. She is the executive director of the National Student Nurses Association. And Diane, take it away.
Okay, good morning, everyone. I'm glad to be here, and I'm glad to be on time. I had to go and get a COVID test today for a procedure next week. The hospital system doesn't seem to ever change in terms of having like a 10 o'clock appointment and not getting done until 11:45. Their system was down, so everything had to be handwritten. So that's how we can depend on computers. Well, I'm just delighted to see everyone. These are mostly doctoral students. I'm so excited about that, Ronnie. They're PhD students, I'm assuming? Yes, that's terrific. Well, you know, I can read all of this, but I think that the first three slides that I have, what I would really like to talk about most, because you can read those yourself, is when you're thinking about what to study. You know, as doctoral students, you know, you have a lot of interests, and how do these interests, you know, start to reach your thinking and your mind, and how can you turn them into a research study? So basically what happened in 2008, as you recall, we had an economic downturn, severe recession. And, you know, we kept hearing there's a nursing shortage. I mean, it was everywhere. People were pouring money into this nursing shortage. And then I had my board members, my student leaders, who were top choices usually for entry-level positions, tell me that they were having a hard time finding a job. And then I saw a severe downturn in the number of exhibits that we have at our convention from hospitals. I mean, there were, you know, usually had about 300 or 400 exhibits, and at least 60–70% of them would be hospitals. And that year we had 2 hospitals, so I knew something was definitely wrong. Something was going on, and what could I do about it? So that was really the first time that I sent out it was a short interview. It was a short survey, and we only got, I only got about 600 responses. But it was enough to know and to see that there was something emerging. There was definitely a trend that was emerging, and that trend was that new graduates were there was an oversupply of new graduates. And that had to do with what was happening in the economy in the country. You know that unemployment went up, people lost their health care insurance. A lot of elective procedures weren't done. Hospitals weren't hiring. And if they were hiring, they were hiring people with experience. And that was probably one of the most frustrating things for the new graduates, was that every job was tagged with 1 to 2 years experience. And they'd say, well, how am I going to get experience? But the point is that, you know, you have to keep an eye on what's going on around you if you want to do some type of research project that has significance and has relevance. Well, the funny part about this was as this data emerged, and I knew very clearly that we had an oversupply. It was totally ignored and denied by the profession, which I thought was kind of interesting. I remember being at a meeting with Peter Bierhaus. I think you all know who Peter is. Peter and I have been, colleagues for years. And he's saying, he's talking about the nursing shortage. I was with a group of people, nursing leaders are standing around, and he's, boasting about his research, which showed that there, is going to be a severe nursing shortage. Everybody's retiring, increased number of elderly, more nurses needed, blah, blah, blah. So I piped in and I said, well, Peter, that's not what my data shows. And it was a little silent. I explained what I was doing, and completely ignored for quite a number of years. Actually, I think, Ronnie, until you came on and added more credibility to the credentials of the studies, and that's true. I was not known as a nurse researcher. I'm an executive director, an association manager, and an educator. And I didn't have IRB approval and all that. So there was some probably a credibility issue that Diane Mancino now knows more than they do. But anyway, they went along for many years, and one of the things that the data discovered, I would ask, did your faculty in the school let you know about what was going to happen when you graduated? And they were most of them were misled by their faculty and their deans, that they were going to be, that there was a nursing shortage and everybody was going to get a job. And then these stories start rolling in. I mean, we got up to almost 6,000 responses one year. The survey was very validated, in terms of the numbers. So they were out there still talking about a nursing shortage, and there wasn't a nursing shortage. And we're right now, this is an interesting time because I think we're going to be facing a very similar kind of scenario, which we'll know soon because we're getting ready to launch the 2020 survey, find out what's happening. So this is one of the only real-time surveys that's giving us data to know what's happening on the ground now. What do you do with it? That's a good question. Because I don't see, even though we publish and everyone now knows that we do this, people, it's interesting, it's almost like we know that 12-hour shifts don't work well with the ability to make critical decision making. But we still have 12-hour shifts in the hospital, and many of them are turned into 14 and 16-hour shifts and even double shifts, when, especially during COVID, people were working nonstop. So in other words, we know what the data tells us, but do we do anything with that data? That's probably a very critical question to ask. And how do you push that data out there? How do you, publishing sometimes takes, I don't know, Ronnie, 4, 6, 8 months, 10 months, a year. By then the data's stale, especially if you have real-time data. So there's a lot of interesting questions around research that's other than the basic, the methodology and the analysis and the discussion and all those things that go into it. But how is the data going to be used? What relevance does it have? Actually, you can see those slides. It gives you kind of a chronology of when Molloy got involved. Actually, Ronnie, it was at a meeting like this that you invited me to, and the students were very interested in the data, and you called me and said, I'd like to work with you. And I welcomed you with open arms. And I'm delighted that you do work with us because, as I said, you add a lot more credibility to the survey And I'm really looking forward to seeing what the data is going to show in 2020, because what I'm hearing, again, what I'm hearing on the ground is that they're having difficulty getting jobs, not only getting jobs, but getting clinical sites. We're going to have a pipeline issue very soon, because the clinical sites are not everyone, but for example, I have a friend who is the chief nurse officer at a big medical center in New York City, and they're not taking any undergrad pre-licensure students, none. And the reason is the nurses have put their foot down and said, we're expecting another run of this virus, and we can't have students around. I had another very interesting report. I was talking to somebody from New Jersey who said that she took her students to their unit that they were assigned to at a New Jersey hospital, and the unit had been converted to a COVID unit, which she didn't really have any problem with until the nurse manager, when she asked for, well, what are the protocols or the masks and all that, they said, well, the staff nurses are required to wear N95 masks, but the nursing students don't have to wear masks. I mean, what? So, of course, she pulled her students out of there, and she's trying to find other clinical settings. And then I heard recently a hospital in Texas, not just a hospital, but in many of the schools in Texas, they are required to provide their own PPE to the students. And many of them, first of all, they're not budgeted for that. It's a whole supply chain issue. So, these things are emerging. I actually, Ronnie, I'd like to do one of my 2-minute surveys with the faculty just to get a better feeling of how prevalent these problems are. Another school program, they're not having any fall semester for their nursing students. It's going to delay their graduation a whole semester. That is if they go back to school in the spring.
One of the things we're going to do for sure, Diane, is to pause. You're getting some things in the chat window of some ideas and some experiences. So, you can't talk and read at the same time, but I'll ask everyone if you sit tight for a bit. We are going to open the microphones because I know this pushes some buttons that people will want us to ask questions because we can get at it. And that's why we do this.
That's great. Well, I can stop talking at any time. I'm ready.
Okay, that sounds good. I'm going to run through some data and then I'll bring Diane back in. But what I'm going to do is show you some background to the Dean's Notes that Diane was talking about. This was in the early one. Diane, you might remember, inaction is not an option. I think you got some pushback. Invest now to keep the pipeline primed, and recalculating the nursing shortage needs new direction. So I remember when you were the only picture on the cover of Dean's Notes, and this is our last one that just came out that points out this pre-pandemic class of 2019. And what we pitched in this and wrote about was, and included some of these COVID-specific responses, is that we know that 2020 is going to look different. And so we have a really good opportunity to capture that. So that's everybody on the call, you get a chance to tell us what else should we ask. And surveys can be a nightmare at this point. What are we, 72 questions, I think? And there were some incredible number of questions.
Eliminate some.
Yeah. We've been asking the respondents a lot, and they're so loyal, and we get such good responses. So let me do really quickly some of the connections to policy that knowing about loan debt is important. Title VIII is the legislative agenda for AACN as they continue to lobby for reauthorization of Title VIII through 2022. You'll hear about that. Right, and know that we need to ask for funding for nursing education. We give them data. We can tell them how we are being impacted by whatever the reports are, but we've been able to use their findings and what they find with ours, couple them in tracking I think our basic message, Diane, agree, if you'll agree with me, is that our data follows the economy. The economy and our data go hand in hand on whether or not people get employed. And it's not what you think. It is not that, you know, if people can't, that the economy is great, that you wouldn't get a job because you wouldn't have to, because people wouldn't retire, because the economy is great. You'll see. We also know, in fact, some of you are recipients of loan forgiveness programs, and that's a congressional piece of legislation that is enacted through the Bureau of Nursing in the Bureau of Health Professions. As discussion continues about free college and loan forgiveness, in the upcoming presidential campaign, one of my doctoral students was able to track the primaries and whose main agenda was loan forgiveness, where that fell, and the data that they used across the country of general college loans, but we have nursing loan debt. I've been called by states because when they try to make a request for state funding, they use our data from the states because we can sort on states. And then knowing in general that advanced nursing education is an important career investment for nursing related to the workforce and in predicting who's coming to school, who's not coming to school, and you'll see some interesting findings with our recent one. So really fast literature to show we use data. I teach you use data. So 45 million borrowers owe nearly $1.6 trillion. The class of 2018, the loan debt was about $30,000, and that was across all. But in 2016, 30% of adults report that they borrowed money, and the mean level of debt was $32,000 4 years ago. We also noted, and this has been contested and presented, that the quick rise of for-profit schools and the predatory recruitment was being focused on by policy debates. And we know that those who attended for-profit institutions were more likely to report being behind on student loan payments than those from public and those from not-for-profit institutions. So we asked that question, and we can show you some of the differences, how much money our students borrow nationally. So the NSNA annual survey is this rich source of data about obtaining new jobs, and we shamelessly ask other questions, for lack of a better word, not necessarily theoretically grounded. Some of our students have done stress studies and future studies and other stuff that maybe those questions are theoretically grounded, but frankly, this one was in response to a problem, and we are able to ask the kinds of questions we want. In fact, I used to have it on my bulletin board, but we had one called In Debt and Misled. That was the fun year of looking at those relationships of students who were misled that they were going to get jobs a couple of years ago. So we focus on a whole bunch of variables. The focus of this report is about their financing and their debt and whether or not they plan to go on for future education. And that's what we usually, as I said, we have other variables in the study. So this 2-minute survey that we launched when the pandemic unfolded and schools were forced to lock down, Diane brilliantly is able to put out these very short, brief surveys and gets a really good response from her membership. And we decided, or she asked me, IRB approved, we did all of those sorts of things because that's kind of what I can bring. And we asked what the COVID experience was doing to students in March and April. And I think the survey stayed open until May. I think it was March, April, and May. But I think the centerpiece was the most responses were in April. So this is in the middle of the crisis. So the analysis that I'll show you now is just some of the quantitative findings. My wonderful research interns are working at the lived experiences in their personal experiences. That narrative gave us almost 1,000 very rich stories that we're going to dive into. But for this, just show you a little bit about putting the employment in context. So pre-COVID, we knew that 90% of our students had direct patient contact, and at the same, they could check as many as applied. 65% 70% had simulation in person, 20–30% simulation online, and about 40% with written case studies or clinical group studies. During the March and April and May that we collected, that direct patient contact went back to 2.5%. That simulation in person went to less than 1%. Simulation online up to 75%. Written case studies went up to 60%. Clinicals canceled or the semester just postponed, 25%. Volunteer time was pretty low. People thought that that would be a great source, but volunteer time in clinicals counting towards clinical hours, very, very low. And clinical time in clinical settings as paid employees, also very low in our responses. So with this ongoing policy discussion, knowing that the new graduates that came out at that time would have a different employment market, we wanted to make sure that we understood how much loan they carried with them, and that this would be important for when we've always done if they got jobs, but whether or not they're carrying that loan debt forward. So the method, web-based survey, we use SurveyMonkey, email sent out with a link and instruction. Subjects are invited to participate, promise that their responses will be anonymous. Brief caveat for those pandemic stories, we also asked, let us know if we can share your story. And I think 90% said yes. They're still anonymous, but that we could share the stories. The initial email was sent in 4 to 6 months. Like we start sending it in September, capture the April, May. We keep sending it until about December. So there actually are some year before graduates who click in and do it. So it's about within a year, 2-week interval reminders, 3 follow-ups, normal kind of web-based survey. So this secondary analysis focusing on just a few questions was the 2019 graduates, more than 4,000, I think it was 4,352 or something, depending on which questions I answered, but we have a really, really robust response rate. So the items on the survey included employed as an RN, type of program, type of school, amount of loan debt, financing option, and whether or not they plan to further their nursing education or what type it would be. So as I said, 4,740 were the most that responded to this survey. Similar to previous years, our data is pretty consistent. About half are baccalaureate students, a little more than a quarter are associate degree students. There are still diploma members in NSNA. About 20% are accelerated bachelor's, pre-licensure. We collect others, but we try to focus on associate and baccalaureate in some of the analyses, but we do have some of the other data. Their numbers are smaller, so you always have to be careful. And this will show you membership percentage represents pretty closely nursing demographics, pretty closely. Mostly female, mostly white, and mostly over 21, almost half, 23 to 32. This is the one I want you to spend some time looking at, so I'll hold it up for a little bit. This is what Diane was talking about. When she started in the West, only 40% were getting jobs. And in the East, and the Northeast, which one's the Northeast? I got to do that. In the South and in the Central, those jobs are plentiful. They have been, and they grew from the recession of 2008 up through hitting what we thought was a peak about 2016, and then plateauing with little dips, probably not statistically significant. But what I want everybody to see is that they're all trending down in 2019. They all came down except for the central part of the country. So, and I know I have some people on the call that can share their experience about New York applications, and We think in terms of New York, but the Northeast has always been hovering around the West and not being scooped up by hospitals or other places for jobs. So this is our employment trend line over the past 10 years that we have shared in Dean's notes. This is employment trends by types of programs and degrees. And if you look at associate, baccalaureate, and accelerated bachelor's, what you see is a continuous decline from 2018 to 2019, all are down. Some not by much. The baccalaureate's only 1% down, but the others are down heftily. This is the one that we published in Nursing Economics, or we've been publishing it as soon as I can get the things written up, because it changes and the new survey is coming out now. But this is the one that this is no loan debt at all, and only about a quarter of the students in our programs have no debt. And then what you see is, as the debt increases, it hovers around that mean of 30,000. But look at some of these at $110,000 of loan debt. That to me was unbelievable. When we first did this, I just could not believe that so many students, when you see how many owed that much money coming out of nursing school. And we had associated that at one point with whether or not they had jobs. So having debt and being misled about the jobs. This is a slide about how did you finance your education. This tells us we've split them out by types of programs. You can kind of guess that parents paid my tuition are not going to apply necessarily to people going back to school in their later lives. But this shows you sort of the relative of how many students click off, they get some type of financial aid, and it's more than 70% have some type of financial aid. We've been asked, I think Diane's been asked specifically about GI Bill and whether or not any of our students use the GI Bill, and there are some. But as I said, these are typically sliced according to the type of program, and I won't get into the weeds on that, but we have that kind of data. Here's the kind of comparison that I think is really important. And we did a statistical test of significance on this. The average loan debt for our study was about $29,000. Fits with across other types of college loans. And when we use the types of schools' average loan debt, you can see that private for-profit schools' average loan debt is over $45,000. Which again, when you look at relative to public and private not-for-profit schools, private's also expensive, we know that. I think we found that you were more likely to get a scholarship in a private school. There were more available. Public schools tend to say our prices are low, so there weren't as many scholarships as I recall over the years. So we've been able to dig down on some of this, and this is what we did, which I love. So thank you, Sharon, and thank you everybody who played with me with, I've talked about Tableau. I could do average loan debt by state and color code it. And what you're looking at right now is a color code of average loan debt by state. And again, thinking in terms of that $29,000 about, you can look at those that are higher and lower. I caution highest and lowest states because they're small ends. Last year, Montana was the highest, and it was 48,000, I think. But this goes up to 52,000, which is Rhode Island, according to our data, and that's only based on an N of 6. So always caution, everybody who knows about data, caution about the extremes. But this shows you relatively which schools and which areas have higher loan debt relative to those that are lower density and lower number of schools that students would be going to. As I said, I love this, is my favorite slide. So loan debt by type of program, you see that associate has the lowest loan debt, and in fact, it's statistically significant compared to baccalaureate average loan debt. But we also ran on this master's direct entry. These numbers are smaller, so always interpret with caution, but These students are borrowing money, clinical nurse leader and master's programs, borrowing money, and RN to BSN, back to where the other regular undergraduate programs are. So I don't know personally from that, but I know that we're always cautious with smaller ends, and some of these, relatively speaking, are less than triple digits. They're in the double digits, but not in the triple, the hundreds and the 400s. That's some of the other data we have. So here's what we thought was important to know. If you owe money, are you going to go back to school? And that's what I think is relevant to making choices about continuing my education. So I took the 2014 data and the 2019 data. We asked a lot of complicated survey questions. So if you graduated with an associate degree or from a diploma school and you're planning to pursue an RN to BSN or RN to MSN, when will you enroll? And what you see here is all of the soon ones dropped off, and all the I don't know and I'm not sure clicked up from 2014 to 2019. So this says to me, with a really nice curve, that I guess we're all sick of curves, but this says to me that there's some indication that if you owe money, you're going to hold off going to school. So we split them up of planning to continue my education, no plans for the next 3 years, to plans to continue within 2 years. And that is statistically significant for average loan debt. And you can see those that have no plans is above the 29,000, which is sort of I don't want to call that normal, but sort of across the board. And then we also asked students if they were pre-med, and if they were pre-med and switched to nursing, because we ask a lot of questions. And the pre-med students, former students, had more loan debt because they, in fact, borrowed money to start med school. So they're taking their med school, that's my interpretation, I don't know that for a fact, but they were statistically significant of those who were pre-med compared to those who were not pre-med, and what their average loan debt. This is a slide that shows you relative comparisons from the year before. So the master's degree in nursing was down in 2018 from 2017 and down in 2019. So it went from 40% to 36% in planning to further my education. The doctorate in nursing practice went up from 2017 to 2018, and then from 2018 to 2019. Unsure baccalaureate all stayed pretty much the same, but the doctorate in research-based, this is near and dear to my heart, went down in 2018 and went up in 2019. So whether or not, if you're not working and you decide I'll go to school, what I would pose is, and we'll talk about it, when there is loan forgiveness for higher education, I think you have people taking it up, especially when they believe that it will help them, or they value education. So not a whole lot, but at least it's up. All right, a couple of fun things for those who are new graduates. The clear finding is associate versus baccalaureate is statistically significant in financing. I told you those financing broken out are pretty clear too, that they're different in type of school and previously in med school, and whether or not students plan to further their education. That's sort of what we had hoped to be able to make as a case and then open it up for conversation. I'll run some conclusion statements here. New grads carry forward debt from their nursing education less than the average overall debt, but nevertheless a burden. And the results obtained from this secondary analysis, and we have more data we could mine. Oh my goodness, we have so much data we could mine, but provides insights on how student loan debt and prior education influences nursing graduates' reported plans to continue in their advanced nursing education. And then finally, as I said, trying to make the case that if we know about how critical loan debt is for planning a future education, I think that we'll be able to make the kinds of recommendations, certainly in planning programs. I remember trying to raise the red flag when I first got to Molloy of when some of my students who were directors of nursing education we're getting 100 applicants for 5 jobs. That's not a good thing necessarily. What we have found, we actually asked the question, did you have an internship or an agreement with workplaces? That I know everyone has found very helpful in getting jobs. So we asked that question as well. Let me close with that and open this up to stop share and see everybody's faces. And Diane, are you still on the call? Good.
I'm here.
Good. Okay, so why don't you add your insights from what you know at this point from what we've done. And then, as I said, this is our opportunity to ask what people know from their personal experiences and what they think we ought to ask. And that'll help us.
Yeah, Ronnie, I think you covered quite a bit there. There were many, many questions. I know that some of your students, for example, used the stress question related to, the study gets bifurcated. I don't know if that's the right word, but when they say whether or not they're working, if they're not yet employed, it takes them off to a set of questions that ask them about what that search is like. My connectivity is going in and out.
We hear you fine. We hear you fine.
Okay,
so
yeah, I'm on the phone, so that works. And then the other, if you are employed, then we went to a whole set of questions about what that employment workplace was like, what kind of support they were getting from various disciplines and their nursing managers, and you know, did they find the job that they wanted, or and that data is also very interesting. We haven't done that much with it. I think we could probably do more, especially now with the COVID situation. It might be very interesting to hear what those workplaces are like for a new graduate. So there's a lot more data and there's a lot more opportunity. You know, if anyone is interested in delving into some of those other questions, that would be great. I mean, I know that Ronnie and I would definitely be open to that, to take a look at all the various aspects of the survey. We've really just, you know, just touching the surface of it. But I think that we have about an hour and 15 minutes. What time does this end, Ronnie? Does it end at 2?
We usually stop talking around 1 o'clock. People start to get ready. And we haven't done a Zoom one. I think sitting in a chair for more than an hour is tough. So let's think about closing this off by 1. But let's leave 15 minutes open conversation. If we get real excited, we'll keep it open.
Yeah, let's do that.
All right, I'm going to ask Marcia if you'll be willing, since you posted something earlier about some of the pre-licensure challenges, if you'll maybe as our dean to start us off with what's very local to Molloy.
Yeah, hold on. This is very interesting data, and you know, having worked in Pennsylvania, New Jersey, and we had a remote campus in California, and you know, having seen that up and down, you know, in 2018, I mean, it really was very interesting. But one thing I just want to say about, you know, our problems in pre-licensure education are that we can't, you know, react as quickly as we might like to the employment situation. You know, our data is always way behind what the reality is. We have really poor response rates, and I don't think this is, you know, specific to our own college, to Molloy, but just what I have seen, you know, at 5 other colleges and universities trying to track our graduates and trying to get data back from them about what the situation is. So, and we also don't have an overall kind of strategic approach to filling the workforce pipeline. And I know when I was in New Jersey and in Pennsylvania, when we, you know, in 2008 to 2011, when things were really challenging for new graduates, we did tell our students, hey, think about going to the South, think about going out West, because that's where some of the jobs were. Students don't want to leave. but we don't have a general collaborative approach in various states to say, do we need more nursing programs? I mean, New York has just approved a couple of new pre-licensure nursing programs. Did we really need that in a state where the prediction was to have, you know, especially in our region in Long Island, the prediction was that we were going to have an oversupply of nurses even before the COVID situation, that we were really not a nursing shortage area, yet the state approved 2 or 3 new nursing programs in the region that probably are going to fill the pipeline. So I think we're not very, we're not able to react as well as we might like to. And, you know, the other thing I was, you know, looking at the data, and no surprise there, you know, I've taught in an associate program for 8 years. It's very inexpensive to get an associate's degree in nursing. I mean, the community colleges are designed for upward mobility of students and for affordability. So of course your loan debt's going to be so much lower. And one of the problems that we've always struggled with, I think, in nursing education is the cost of a baccalaureate degree, you know, versus the cost of other kinds of, you know, of other kinds of programs. So I mean, it's very interesting and exciting to see this kind of information that you have. Even some of the private, not-for-profit colleges are a little bit predatory in their approaches in terms of telling students, sure, take out loans so that you could afford our $60,000, $70,000, $80,000 a year cost of education. So there's a lot going on in your data that, you know, the context is very deep for a lot of things that are going on there. But, you know, to come back to your question, Ronnie, about the lived experience, yes, we in this area, and I think I could speak for a large majority of, you know, my colleagues who are in the New York metropolitan area are really struggling to get clinical experiences for our pre-licensure students and to a degree for our APRN or other advanced role kinds of students. And while the clinical experiences are available for those programs such as Molloy's that are very high volume programs where we place, you know, we have 200 clinical groups per semester sometimes. That's 1,600 undergraduate students. You know, restrictions on the clinical placements have meant, you know, we could place some, but not all, or we could place all, but for very limited types of experiences. And everything that you mentioned, Diane, in terms of, you know, having to cover the costs of certain preclinical clearance requirements, such as fit testing for an N95 mask, right, Susan? Such as, you know, students having to provide their own PPE to be able to enter the clinical facilities. We're seeing all of that. You know, the requirements have been evolving, and I would say through the summer, every week, we found out that there was another requirement. There's no standard for it. And so it is, you know, with, you know, it's either burdensome and costly for the program, or we pass the cost on to the students, which raises the cost burden for them already at a time when there's a, you know, a horrible economic challenges. So, I mean, we have all of those lived experiences of many community agencies saying no students now, because they were, you know, they service people who are in the high risk group, and they don't want to risk having too many strangers come into their facilities or be engaged with their clients, even though, of course, you know, these are, you know, healthcare professional students and know how to handle themselves. So we have really seen every single one of those challenges here. And as I said, I feel like all of my, you know, colleagues at our other schools in the area are reporting a lot of the same kinds of things, but maybe not the magnitude that we have here since we have a lot of students. Thanks.
Thanks, Marcia. Sue, you've been called, and you also had noted in the chat, anybody else who wants to weigh in, just put something in the chat and I'll be able to call to ask you to unmute your phone. Sue Chin, Dr. Sue Chin.
Thank you. It still sounds funny. Hi, I'm Susan Chin. Dr. Mancino, thank you, and Dr. Feig. This is very interesting. And I just want to comment on two things. First, that nursing shortage that you weren't really experiencing from the student end. I can say what I have seen over the past 4 years. So to take a step back, I'm program director for school affiliations at our hospital. It's an 11 hospital system, and we have 2 large medical centers. So I do all things with the students, but I can see that, you know, we were waiting for our nurses to retire. And in fact, you know, I started as a nurse in 1987, and it was very unusual that you would see someone maybe, you know, over 45 working on a hospital on the floor. And now we have nurses in our 60s, well into our 60s, that are working as clinical bedside nurses. So that expecting people to retire is just not happening. And then the other thing I want to comment on is with COVID, I think that's really going to dramatically impact student employment opportunities, because in the hospital setting, and maybe this will be temporary, but I think people are afraid to come back to have procedures done. And so we're probably at 70 or 80% of our pre-COVID volume. And so then that impacts staffing numbers, and then people not wanting to retire. We're having, you know, I've seen the new graduate hire position openings that are available, and they are drastically fewer than they were this time last year. The other thing I want to comment on also is the number, as I think Dr. Gardner pointed out, the number of programs in the New York City area. We're just flooded with large schools with large numbers of students. For New York Presbyterian Hospital, we have about 10 schools of nursing that we work with. It is 11 hospitals, but 10 schools of nursing, and some of them are very, such as Molloy. So it's really hard. I think we do a good job. Some of our units have clinical groups 4 or 5 days a week, but now that COVID has come around, we've had to really drastically cut back. We place about 3,500 undergraduate students a year through our system. And for this fall semester, we severely restricted. It was really heartbreaking, but given the resources, the PPE resources that people have mentioned, and then expecting the second wave. In addition to that, we're cross-training nurses to help out, and critical care is needed. So there's a lot of factors aside from just COVID volumes and PPE that are impacting our ability to take students back. And I think that will eventually have an impact on the quality of student that's trained. And I predict that it's eventually going to fall on the hospital's shoulders once we have a true nursing shortage, where they're going to have to really beef up their orientation program so the graduating nurses will be up to snuff and be able to perform. I think that's it.
Thank you so much for that. There's a note in the window. I'm not sure if Jose will be willing to unmute his microphone. Jose is a prospective PhD student who's asked a really interesting question of me. One is how the data are collected. They're collected via SurveyMonkey. They go to all of the past members of NSNA graduated, and we get the responses if their emails are still up. We have, of course, all of those limitations with web-based surveys. We get a very robust return rate. We approach 10% of what we can say for sure of those who might have gotten them. There's dropout as well. So I'm always cautious about it if they're selectively dropping out, or if they're only dropping out, if they're randomly dropping out. So we've done this so many times, and since our findings are consistent, I'm pretty satisfied that the numbers represent those that are working and in demographics and other things. So you say that even though your survey is below 20–25%, which is acceptable in social sciences, which is still sounds terrible, but there's just all kinds of, you all get surveys and you don't have time. So I'm trying to make the case. Diane just helped me publish for nursing students in imprint. to say when you get a survey, answer it, because it's the way we find out information about things. So that'll come out in print in November. So that, I hope that answers your questions about, now you asked about projections of retirement. We don't ask the nurses, but we ask the students in your job hunting experience, what are you hearing? And we have tracked in past Dean's notes that people are retiring is one of those items. They're pretty good proxy because they're hearing it with their job searches. Whether or not it's real, we don't know. I think, Sue, you give the best indication about, because you're on the ground, of who isn't retiring. Some have projected that with COVID, people just say, the heck with it, I'm not. But with the economy on top of it, we just don't know. And those are the kinds of questions. Again, this is from the participants' point of view. So Jose, did I cover that okay for you? Would you like to be willing to click on your mic and speak? All right.
Hi, I'll be a little.
Welcome to Molloy. We're talking you into you're taking a course this semester, and you'll start maybe in the spring or next fall.
I hope so. If I sporadically turn my back, as my three little minions like to make a habit of appearing on screen without being invited to. In my role as a director and sort of looking for nurses to hire, I've been that person that's had one position and I've had 100 applicants, and I literally go through every single resume just because I always fear that I may not give someone an opportunity that otherwise wouldn't have had it, regardless of what school that they went to. The question I was asking was more so just from the ground. I've spoken to enough nurses. We like to say a lot of things, but then we don't act on them. And I think a lot of it is just based on the frustrations that we have on a day-to-day basis. So how does one measure when someone will actually calculate? Like, we have a measurement of how many students come out every single year. We have a measurement of how many people are actually getting licenses every single year. But how do you calculate when someone finally says, that's it, I'm retired, no more working for me? How do you get that? What I feel I see is there's an oversupply of nurses in New York region. It makes it much more challenging for the new nurse coming out because everybody just wants a chance. And the nurses that the folks now want experienced people because they don't want to invest in the training because training costs money. And so because everyone is nursing is everywhere. Yeah, DNPs, you got all this type of stuff. People are just super interested in everything. It's hard to keep them there because, again, they want personal growth, and that's understandable. But that's what I sort of find is the challenging part.
Thank you. Thank you. And thank you for being willing to unmute your mic as a prospective student. Let me hear from our faculty. Anybody want to click in? Yeah, Jerry, please.
Okay, I couldn't unmute. One thing that I was thinking about when you were speaking about how COVID was having an effect on the students, it might be interesting to see how does COVID have an effect on their job choice. What I mean by that is how many students come in saying, I want OB, I want peds. And it's now only 6 weeks. Now we have COVID in the mix and it's might only be simulation. How is that going to affect their choices? And also, how is that going to affect their hiring if they are not getting a true capstone experience? Will that have an effect?
Yeah, Beth Cotter, I saw your hand up, but like type in the box. So I have that running too.
Oh, okay. So I'm just going to piggyback on to Dr. Moore's comment. It's also going to impact their choices of where they want to work, in regards to the specialty areas. Some of our seniors say, I'm going into ICU, I'm going into here. Now the hospitals are trying to get them into areas such as the OR, but then when Sue just talked about how the cases are going down, that is going to affect, there's a lot of things it's going to trickle down in all the areas. So their choices of where they can get their first job. Did you ask that question though? Did they get their first choice of what job they wanted? Everybody wants critical care, they say, right? So did they end up in a nursing home? Did they end up in a peri-op area? Like, I know that is a new trend where everybody wants them into peri-op, but now we have the effect where nobody's going for cases anymore. So it's all going to trickle down. But I do think that choices are going to change. I love when my two daughters are nurses, and when they talk about their precepting, I'm so happy to hear that, because then some students are getting jobs. I don't think the students used to be able to get the fellowships that they wanted and the critical care things that they wanted. They're not getting that anymore. So I think did they take their first choice? Did they take a second choice? I don't know. So it's gonna
Thank you. That's really helpful. Diane, I don't know if you want to unmute. You know, we ask a boatload of questions about first choice. How far did you have to go to get a job? You want to talk a little?
Yes, we do ask that question. Sorry, and the trend that we noticed was when we had the severe oversupply. For the most part, they did not get their what we call their dream job, because they were only getting jobs in long-term care facilities, nursing homes, and so forth. But as the job market opened up and the economy improved, there were more people getting their dream jobs. That's something that we actually can do an analysis on that, Ronnie, because we have that data. It'd be interesting to see.
We can add questions to that one. It's just those are really hard to do the kind of clean comparisons. So we tend to only have, to be geeky about it. There are only yes, no kinds of answers and checks. We got to figure out some way if we can frame it in what Beth said of in your COVID experience, because that's what we'll be sending them. If you were restricted in your experience in graduation, and then if that infected your job choice, we need to make that a specific question that I think will be one that we'll add, and that won't be hard to add. Can I ask my new intern, Ciara, I don't know how comfortable you will be in unclicking your microphone and talk about being a nursing student, how that's affecting you?
Yeah, of course. So I feel that for like new graduate students and seniors who I'm in my classes with now, I feel that many of us are more at the point of we're questioning what kind of nursing we want to go into, because there's different fields that we won't have as much experience in. And people might have been saying, oh, I want to go into Peds OB, but then we got cut halfway through that clinical experience. So there's no really saying. And then to also put on the pressure of the fellowships and stuff like that, we don't know if that's even something we want to invest our time into, because say I get into a fellowship program, I start the fellowship program, I might not even know if it's something I really want to do. It's just kind of a thought in my head that it's something I might be interested in, but it's also a time commitment. If you do get into a fellowship program, it's what if you start it and don't like it, and then you're putting pressure on yourself to stay in it because you don't want to waste your own anyone else's time, and it's an amazing opportunity. But I also feel that kind of piggybacking off what Dr. Cotter said is getting the dream job experience, and just trying to figure out if I don't think many of us have the pressure of feeling that we're not going to get a job. And I don't know if that's just because all the way along nursing school, people have been telling us, don't worry, you'll get a job. I think it's more of putting pressure on ourselves to make ourselves the best possible candidate to get our dream job.
Yeah, thank you. That's important. And we'll figure out a way to include that. Jose, thank you for the suggestion. Olga, I'll call, I think Anne-Marie, you had a comment in the chat box. I'm going to give you a chance then, Olga. But Jose, thank you for the way to ask that virtual experience question. It was Anne-Marie's question. So Anne-Marie, say it. And if you saw what he suggested, that sounds wonderful to me and Diane. No, you're muted. Oh no. Let's hope.
Hope, right?
Good.
Yeah,
good.
my speakers are not working at all, so hence the headset. Yeah, I guess, there is research, that indicates we can replace some clinical experience with simulation, but now even simulation has been severely limited because it is also face-to-face. And so I used to have a full day of simulation. I now have 2 hours for my students. So, we moved into the virtual environment, but I think going forward, or, as people probably more of a look back, but asking a question about, is there some relationship between having virtual experiences and their confidence levels? Does the virtual experience actually provide that same experience, I guess is the way I want to put it, and will they really feel confident when they're facing patients if most of what they saw were avatars, on a screen? So that would be something that I think would be interesting to ask. I know it doesn't have anything to do with loan debt and all that, but I think it would be something to
Yes,
know.
guess what you're going to help me do as a advisory board member in the center in crafting that particular question of does virtual
Okay.
experience affect new nurses' confidence? So you're on with that one. So
Okay.
it's 10 after. I had said that I thought we'd run out of steam, but I know Olga had her hand up. And I see Lorraine has a comment. So let's do Olga and then Lorraine and see if we still want to hang on. You can always click out anytime.
I'll be brief because some of the things I wanted to mention, Jose and Emery already sort of mentioned, which has to do with augmented reality and virtual reality and mixed reality. And I feel like COVID is here to stay. And I feel that I wonder when you do your surveying post-COVID, I mean, during COVID, whether the schools that have been on a cutting edge in terms of having those technologies with simulation and all this virtual realities, it would be the people would be responding differently versus schools that perhaps don't have that infrastructure in place. So I think that's one of the factors. And another issue that was brought up earlier, and I have to say thank you to Susan Chin and some other colleagues that were really helpful and accommodated some of our even clinical students, like in informatics, for example. We can't replace that with virtual reality. This is something that is a different type of graduate clinical experience. And so this year we had difficulties placing students because hospitals are not taking them. And so we had to figure out some remote opportunities. And given that everybody is now doing remote business, so to speak, I was able to find places which I think they'll be getting excellent experiences from. It's just these are places we have to go out and look for, and they're not always hospital-based experiences, which is great too, because nursing is not limited to just hospital setting. And I've said that before, and I feel like many people are not on board with that just yet because everything is about hospitals, but nursing is so much more than just hospital setting. And so I think being open-minded and sort of going with the flow and trying to look for opportunities that are diverse would probably be better for nurses because it gives them confidence. Okay, so if I don't get a job in the hospital setting, guess what? Maybe I will be working for Microsoft and creating those programs for hospital setting. So, I think it's important that nurses don't always limit themselves to just one clinical setting. Thank you.
Thanks, Olga. And I had said, Lorraine, I'll open the mic for you to follow up. You also asked the question about self-confidence. Diane and I have this 18-item measure of stress. We actually had done a study on stress and amount of simulation in previous presentations we've done. I'll give you a little caveat about that the schools without much simulation, the students had less stress talking to people, just so you know. And you probably might not be surprised, but Lorraine, if you want to add that confidence one.
Yes, I was just wondering, because as we know, new nurses do have low levels of self-confidence to begin with. And the fact that they're going an entire year with less than the usual amount of in-hospital experience, much of it virtual, does that impact their choice of where they'd like to work? And how are they feeling once they start working? What is the impact on them once they start, they get a job and they start work as a new nurse graduate?
That'd be great. That'd be great. And Diane, that's our challenge, is trying to figure out how to quantify amount of simulation. There's such variation. We had to aggregate things, put them together as proxies for very little simulation with a whole boatload of simulation, because it just is so varied across the country. But we were able to do that on stress. And what I think we could do is find a way to capture confidence, as Lorraine and Anne-Marie both suggested. And I welcome both of you guys to work with me for new questions, because we welcome the new questions. Let's say, anybody else have anything in, Dr. Gardner? why don't you unmute and why don't you, as our opening welcome to Ms. Zadine and closing, why don't you help us wind this down unless anybody else wants to ask more questions, put them in the chat window. Dr. Gardner?
Well, I mean, I guess I would echo what Olga said, which is that, you know, I mean, we've been talking since, I don't know, 1965 about, you know, moving healthcare, you know, out of the acute care setting into the home and so forth. And so I was just thinking about how, you know, public and community health has really come to the forefront. And most new graduates, Ciara, you know, are very interested in taking a position in acute care, but the need may be also in more public health oriented kinds of settings where there's more distributive care and so forth. And so do we need, maybe that's a, and you know, maybe that's a kind of a question for the future as to whether new graduates are starting to think about opportunities that go beyond, you know, their dream job in the acute care setting, working in a critical care setting and those kinds of things. And I wonder if, you know, maybe some thinking has changed about that. There is more perhaps opportunity for that. But, you know, I do think that we need a much more strategic approach nationally to filling the, you know, the workforce pipeline, that we need a, you know, a more of a thoughtful and collaborative approach. I mean, one of our biggest problems is that we have these state by state differences and requirements. I'm actually starting a project that's looking at clinical hours and whether clinical hours are tied to any real outcomes. Because, you know, there are 4 or 5 states in the country that require a certain proportion of specialty clinical hours or require completion of clinical hours, and other states that don't have the requirements. And why is this, and what makes for a quality clinical experience? There are so many, you know, I think interesting questions about that. So, you know, all of those things that you're talking about, just do, how is simulation defined? Will a new graduate know what virtual simulation is, or avatar based? How do you guys see that, Ciara? I mean, do you know what that is? Does everyone know? You know, the quality of a simulation experience may very much affect the outcome for a student. And so I think, you know, there are just a huge number of opportunities here to think a little more deeply about how best to prepare new graduate students for a very rapidly changing healthcare environment. You know, I mean, I guess if that's a summary of what you're all challenged with.
That's really great. I'm sure it warms Jerry's heart too, of other kind. And I think I think that's something that's on us. Of you know, and Ciara, you're going to help me as my intern in finding ways of how do you even promote that. And Renee is on the call. Renee did her dissertation on whether or not undergraduate students have any interest in advanced education, or are they all going to be whatever it is they think they're going to be. So Diane, we have our work cut out for us. I'm gonna let this call end, but I feel all unmute your mics and give Diane and me a round of applause. We'll call that the end.
Thank you. Excellent.
Thank you so much.
Good luck. Good luck to the students.
Good luck, everybody.
Thanks, Diane.
Thanks, Diane.
Thank you, everybody.
Bye. Thank you.
This is a really interesting presentation. Thanks a lot.
Thanks, Marcia.
Thank you. Bye-bye now.
Bye, everyone.